Excellencies, friends, ladies and gentlemen, when my then fellow African heads of state and government and I established the African Leaders Malaria Alliance, ALMA, in 2009, our vision was very clear that we must defeat malaria to save lives, unlock socio-economic transformation of Africa, and put the continent on a path to shared prosperity. We cannot achieve Africa's Agenda 2063 if we don't succeed to end malaria, HIV and AIDS, tuberculosis, and other debilitating diseases on the continent. Also, if we do not strengthen our health systems in line with national and continental policies, as well as global guidelines. Currently, in Africa and the world over, we are faced with the emergency of COVID-19, an unprecedented challenge that touches and affects every aspect of life and every person around the globe. We need to ensure that all countries in the world comply with the international health regulations in these challenging times. It is heartwarming to note that the global response to COVID-19 has been encouraging and inspiring, although much more needs to be done. People have adopted new behavior to protect themselves, their loved ones, and their communities. People have been washing hands, sanitizing, wearing face masks, and practicing social distancing. Vaccines have been developed in record time. As we acknowledge efforts being made to make COVID-19 vaccines available to everybody on this planet, we must continue to prioritize malaria interventions. We should never neglect the fight against the #1 killer disease on the African continent. We need to address inadequate coverage of malaria interventions. This requires increased prioritization of malaria control at all levels of decision-making, provision of adequate financing, strengthened surveillance and data use to better predict and manage epidemics. It also requires leveraging on existing partners and enhanced focus on health systems, strengthening and multi-sectoral collaboration. The scorecards have enhanced accountability and action, leading to rapid policy change, enhanced performance and resource commitments to training, mentoring, procurement, and addressing upsurges. Zero malaria starts with me. Zero malaria starts with us. I thank you for your kind attention.